Understanding the common patterns and presentations of closed globe injury in a given population helps to improve preventive strategies, optimize treatment protocols, and reduce the overall burden of trauma-related vision loss. Aim of my study was to assess the common modes of closed globe injury and to assess the common presentations of closed globe injury among patients attending our department and materials and methods. The present prospective study was done at our department from June 2024 to May 2025. Inclusion criteria: patient with closed globe injury presenting to ophthalmology department, and exclusion criteria: patients under the age of 6 years and patients with polytrauma incapable of cooperating for study. Consent will be obtained from patients after selection of cases for the study, and patient's demographic data is noted that includes age and gender. Then detailed history is taken, which includes mode of injury, presenting complaints, duration of complaints, and clinical profile is recorded, which includes best corrected visual acuity, color vision, contact sensitivity, and intraocular pressure. Patient then undergoes detailed anterior segment and fundus examination, and data will be entered in Microsoft Excel and analyzed in SPSS software. Results: in our study, we got that most of the injury occurs in the age group between 45 to 60 years, out of 55 with a frequency of 18 and a percentage of 32.7. And in our study, we got males are more commonly affected. There is a frequency of 38 out of 55 and percentage of 69.1. And most common mode of closed globe injury was workplace injury. Out of 55, 23 patients presented with workplace injury and a percentage of 41.88, followed by household injury 11 frequency and percentage of 20%. And in this graph, we can see that in workplace injury and sports injury, most commonly it is affected in males, and household injury, most commonly it affected in females. And the common presentation of closed globe injury was traumatic uveitis. Out of 55, 40% of patients came with traumatic uveitis and 72.7%, followed by commercial retinae 25 and percentage of 45.5%, and followed by lamellar laceration 20 and percentage is 36.4%. And common presentation of best corrected visual acuity was in the range of 6/12 to 6/18. With a frequency of 32 and percentage of 58.18%. And most commonly, the poor visual acuity at the time of presentation was associated with workplace injury and sports injury. Discussion: ocular trauma is one of the most common causes of unilateral vision loss. In our study, out of 55 patients, 61.91% were males and 30.9% were females. And this is probably due to increased exposure of males to road traffic accident and workplace injuries, and many studies have shown the similar results. The incidence of ocular injuries were high in the age group between 45 to 60 years, and this is probably due to increased work-related exposure in this group. The most common mode of injury was workplace injury, followed by household injury, sports injury, RTA, and assault. According to study conducted by Ajay M. Tamevar et al., common mode of injury was also occupational injury. The most common presentation was traumatic uveitis and followed by commercial retinae, then lamellar laceration, hyphema, and retinal detachment and choroidal rupture. Sports injury and workplace injury leads to poor visual acuity at the time of presentation. Conclusion: closed globe injuries were more common in males, and it is more common in the age group between 45 to 60 years. Most commonly occurs at workplace, highlighting the critical gap in occupational safety practices and inadequate use of protective eyewear. Public awareness about wearing protective goggles, face shields, and early interventions can effectively reduce the number of ocular injuries and its related ocular comorbidities. Thank you.
Probably any study will have flavor if it is connected to intervention. Like you have a spread of injury, okay. We'll be more interested in knowing how far they reached the hospital. When was the intervention timed? Whether it could be done within the first 2 hours. Then how much outcomes were generated in your cohort? Like you are saying, no, workplace injuries this much, that much, how much of visual recovery could be done? How much when ended up with poor vision? That kind of perspective, you are adding it in the conclusion, but
yes,
you are saying effective intervention is very good in these cases. But that conclusion has no value because you haven't touched upon it in the study. So try to look at it from that perspective from whenever you do a further study. Okay.
Thank you, sir.
Okay, in the household injuries, what was the gender bias? In household injuries, was there a gender bias noted?
Yeah, ma'am. Females were more commonly affected.
Yeah, that needs to be highlighted too. Okay. And in workplace injuries, most of them are medical legal cases. So we have all that noted down, and all that is also important. Okay.